Just a second here to let folks filter in. I will keep an eye on our waiting room, but want to be respectful of everyone's time today. Thank you so much for being here at the end of your workday. There has been significant discussion around the impact of federal funding on local programs and nonprofits over the past several months. And so we wanted to take this opportunity to zoom in and really localize that discussion. So we have today Dr. Beth Keeney from Life Springs, Brad Wood from Ohio Valley Opportunities, and Shalise Stover from Southern Indiana Works. My name is Adrienne Jamison. I'm the Executive Director at Community Action of Southern Indiana, so I'll be helping facilitate today. According to the Urban Institute, nonprofits in Indiana have $3.3 billion in federal grants to facilitate throughout the state of Indiana for various purposes. For Southern Indiana, that breaks down to $158,000 in Washington County, $235,000 from Crawford County, $8.7 million in Harrison, $17.7 million in Floyd, $26.2 million in Jefferson County, and $46.5 million in Clark County. Today, we brought together a diverse group of nonprofit leaders to shed light on the real impact of this federal funding in Southern Indiana. So I'd like to invite each of you to do a quick introduction, share a little bit about your organization and which parts of Southern Indiana that you serve. Dr. Keeney, will you start us off?
Absolutely. Thanks so much, Adrienne, for getting us together to talk about this really important topic. I think it's been such an interesting time, and we were kind of talking beforehand. It's been such an interesting time of rapid change, especially in the policy environment as well as the funding environment. It's just really great to be with all of you today, talking about how it's impacting services in Southern Indiana. So just a quick introduction. As Adrienne said, my name is Beth Keeney. I'm the president and CEO of LifeSpring Health Systems. We are a community mental health center as well as a federally qualified health center. And what that means is that we provide comprehensive health care as well as behavioral health and substance use disorder treatment, regardless of the ability to pay. Our offices go as far west as Spencer County in Rockport, Indiana, and as far east as Madison or in Jefferson County, Indiana, and then all the way up to Scott County or in Austin, Indiana. So we have offices in 11 counties. We see about 20,000 patients a year, and you can think of us as your community health safety net. So we see everybody regardless of their ability to pay, which means that we provide care to you if you've got great insurance or really bad insurance or no insurance at all. We do basic primary care as well as behavioral health care, which is what we're primarily known for. So individual therapy, group therapy, we do medically managed withdrawal, so folks can stay with us for up to 28 days in a residential environment. We also have a robust crisis continuum. So I'm going to plug that number really quickly, and the number there is 833 SAFE 988. You can call us and we will make sure that you have access to behavioral health crisis services 24/7. And that ensures that when somebody's in a behavioral health crisis, there's somebody to talk to. We can actually send somebody out to you if needed. And then we have a place to go that just kind of allows somebody to just take a deep breath and figure out, like, what do we need to do in this moment? So really comprehensive health care, again, across Southern Indiana, regardless of the ability to pay. So thanks again for having me. Excited to talk with Brad and Shalise about what's going on in the policy and funding environment.
Thank you. Brad, would you like to go next?
Hi, everyone. My name is Brad Wood, and I am the Executive Director at Ohio Valley Opportunities. And I just want to say thank you to Adrienne and the rest of the group at Cassie for putting this together. I'm very excited about being here. I always love the opportunity to talk about the work we do and the people that we assist. So thank you for having me. Ohio Valley Opportunities is a community action agency, and we promise to change lives, embody the spirit of hope, improve communities, and ultimately make America a better place to live. Last year, we assisted just over 13,500 hardworking Hoosiers and their families who struggle to make ends meet. At OVO, our vision is to provide quality services that assist low-income individuals and their families take charge of their lives to become financially stable, realize their full potential, and become participating citizens and leaders in their community. We believe in a future where aspirational working families move into the middle class, and we're committed to making this vision a reality through our outcome-based programs, responsive initiatives, and effective community partnerships. So all of that being said, what do? We operate the Head Start Preschool program, the Housing Choice Voucher program, also known as Section 8 or formerly known as Section 8, the Energy Assistance program, and the Weatherization program. And our programs touch Bartholomew, Clark, Decatur, Floyd, Jackson, Jefferson, Jennings, and Scott counties. So I think I got all of them. So yeah, thanks for having me.
Quizzing everyone on their counties and Indiana geography today. Shalice, go ahead.
Hello, I am Shalice Stover. I am the Vice President of Southern Indiana Works. We are the Workforce Board for Region 10. We've served 6 counties: Clark, Floyd, Scott, Harrison, Crawford, and Washington. We provide business resources to attract, train, and retain talent through a connection with job seekers at the American Job Center. So the work one. We provide career training services that equip job seekers to increase financial mobility, to help businesses grow and prosper, try to, help them succeed. So we have a number of different workshops here. We just want to help everyone, help them reach self-sufficiency.
Thank you for that, Shalice. I know we're a big fan of everyone's work, and we have a Work One office here in the Cassie building, so it's really nice to be able to partner in that way. Today's discussion is about the impact of federal funding in Southern Indiana. For some transparency and context, Community Action of Southern Indiana is over 90% federally funded across our different program areas. We have about a $9 million budget. So that gives you some idea of what that looks like for us. Shalice, would you mind sharing what that looks like in your organization?
Yes. So we are about 42% of available funding this year, but SIW is not directly federally funded. We administer services, and our programs, they're actually have the funding that is funded federally. So those programs, they aim to enhance the skills that employ the individuals into our region. So it's kind of, through us. It's kind of, I guess, it comes down through the federal government, and it goes through the state. So it doesn't really touch us a whole lot, but 42% of us, our funds are federal this year. So almost 50, but it's 42%.
Thank you. Brad, do you mind sharing?
Yeah, like Adrian, ours is over 90%. Like Shalice, that is, a combination of direct federal funding or through the Indiana IHCDA, Indiana Community Development and Housing Authority. Yes. We recognize that it's a lot. And we're trying to diversify and see what we can do to make that less. So maybe if you have this next year, I can report that it's only 85%. We'll see. So.
And Beth, I know this might look just a little bit different for your organization. It's pretty complex. Tell us what that looks like for you.
Absolutely. But first, I want to just compliment Brad on getting the acronyms right. I mean, I don't know how it is in your environment, but just the language gets more and more complicated with all the letters and the acronyms. So good job, Brad. For us, it is really, it can get really confusing because so much of, and I think Shalise said this as well, so much of the funding that you get from the state actually originates with the federal government, whether it's passed through block money, or grants that the state receives and then they subrecipient out to entities. So I would hesitate to put a percentage on it. To complicate it in healthcare, you do actually have federal payer sources. So if we see a patient who has a Medicaid or a Medicare or a veteran's VA benefit, that payer source may actually be a federal dollar, federally sourced dollar. So it can get really complicated. I would just sum it up by using a very precise math term and say it's a lot. That is a very specific number, a lot. And so a lot of our budget comes from the federal government.
Thank you. And I'm going to ask for just a little bit more detail. You shared earlier that Life Springs is a federally qualified health center. Can you tell us more about what that means and the impact it has on the communities that you serve?
Sure. Federally qualified health centers. So just, I'm going to take it back just for any trivia players out there. You may need this. Actually, community mental health centers came first, and that was the last piece of legislation that President Kennedy signed before he was assassinated. And that came from a desire to make sure that there was a robust response throughout the country for folks who have behavioral health issues. So when President Johnson came into office, he thought hey, this is a great idea, and we should do something similar for physical health. And I always think that that's so interesting because it usually goes the other way. Like usually we get like this great physical health benefit, and then later somebody goes, hey, we should do that for behavioral health. But it actually happened first for the community safety net programming. So President Johnson did the community health center programming. I think it was 1964. Community mental health was 1963. And that was established by Congress in Section 330 of the federal budget. And that's where it still lives. It still lives in Section 330 of the federal budget. And so throughout the country, there is a network of community health centers that provide comprehensive primary care regardless of the ability to pay. And so and it is the nation's largest network of primary care providers. We also have lower healthcare costs and better clinical outcomes than traditional primary care providers on average. So not everyone, but on average. And so what it means for Southern Indiana, we're not the only FQHC. There are several other FQHCs throughout Southern Indiana. They're terrific providers. What it means is that nobody has to go without healthcare services. So you can get your vaccinations, you can have your well woman checks. If you are sick with bronchitis or you think you might have strep throat, you don't have to default to the emergency room. You can access care at the right level at the right time. And so we've created a safety net throughout Southern Indiana, along with, again, other federally qualified health centers that really makes sure that vulnerable populations have access to care regardless of their ability to pay. Now, we do have a special designation, a special populations designation, where we are a healthcare for the homeless agency. So we actually do quite a bit of work with individuals who are at risk, at imminent risk for being unsheltered, as well as folks who are actually unsheltered. And so we work hard to make sure that truly those who are unserved and underserved have access to health care. And a lot of that is federally funded. We also bill traditional insurances, but that program primarily relies on Medicaid, which is a state program that is federally funded.
Thank you for that. I know we've heard a lot about Medicaid as well over the last couple weeks. Brad, for community action agencies like CASI and OVO, we've traditionally leveraged considerable funding, federal funding for a variety of our programs. We both said over 90%, but I think one of your largest federally funded initiatives is the Energy Assistance Program. Can you tell us more about the scope and impact of that program in particular?
Yeah, the energy assistance program, I think there's kind of this misconception that it pays all of the bills, all the electric bills. But it's important to note that the state's energy assistance program is a one-time supplement towards heating costs. And, essentially our role in this is verifying need and efficiently assisting families who are in crisis or in hard times come out secure on the other side. So this past winter, we assisted 5,700 families with a heating subsidy, and that's just over 12,000 Hoosiers across the 5 counties that we serve with this program. And this may have been as small as a $75 payment to their electricity bill or a few $100s on their natural gas bill. It's not only those two things. For some, it's a small supplement towards liquid propane or fuel oil, firewood or wood pellet. Because we recognize that there are many ways to heat your home, and everybody's a little different in the way that they heat their home or how they choose to heat their home. It's also important to remember that it's not a long-term abused program. It's a program that helps families during the cold winter months here in Indiana not freeze, essentially. And of those that we assisted last year, just over 50% were elderly or disabled, 38% were children under 18, and 50% were single income households, and 34% were homeowners. So it's a wide variety of people, but the vast majority of the people that we serve with all of our services are elderly, disabled, veteran, or children, or single parent households. So that's important to know.
That is important to know. I think it speaks to the desire for our programs to move people forward. I think I've heard each of you mention self-sufficiency, that's the goal for a lot of the programs that we offer. So Shalise, for you, Southern Indiana Works offers so many amazing services aimed at self-sufficiency. To start, but I'd really like to hear more about one of your federally funded programs that has grown significantly over the past year. It's gotten tons of great feedback and news. Tell us about the JAG program.
Yes, so Jobs for American Graduates is a national workforce preparation program that provides opportunities for success to students who have experienced challenges or traumatic life experiences. So Indiana's JAG program is among the best in the nation. The students learn in-demand employability skills and are given a proven bridge to post-secondary education, the workforce, or other, career enhancing opportunities. Students learn and compete in areas as, career decision making, business planning, financial literacy, project-based learning, and even public speaking. We have over 21 JAG programs regionally. We've grown. So the current Indiana state budget does not include funding for JAG. It's been vital that the full budget be restored and the day-to-day operations of the program be maintained by the local nonprofit workforce board. So we're trying to get that passed.
Yeah, and to zoom out from that a little bit about, why does this matter beyond just the JAG program specifically? There's been a lot of concern more broadly around the economy and employment and how the labor market's going to be affected. What insights can you offer on this? What does Southern Indiana Works see as the most critical need right now?
While certain factors such as like technology and finances have seen shutdowns in other areas, healthcare and manufacturing, they're growing. I guess there's different things in the market that are shifting, but to support our community through this transition, we have partnered with our local employers, and they provide different, on-the-job training, placement, and we offer, career counseling, workshop, and we prioritize equity and ensuring all individuals, regardless of their backgrounds, if they have like disability or newcomers to America, and justice impacted individuals have a seat at the table. We believe that by working together with our community partners, we can not only cushion this impact that is shifting our economy, but also build a stronger, more inclusive workforce. We do want this collaboration with all partners in the community and want to help this, you know, transition with the things that are happening in the community, you know, make it be easier.
Well, and I think one of the discussions we often have around employment, around barriers, and just job market access is that access to childcare and to early childhood education and how those all feed into our workforce. So Ohio Valley Opportunities and Community Action of Southern Indiana both offer Head Start. Brad, will you tell us more about what that looks like in your counties and why these services are so important to working families?
Yeah, sorry, it helps if you unmute. Head Start, I think there's this misconception around Head Start that it's a daycare, that you can drop kids off, they get some food and a snack, and sing some cute songs. But it's so much more than just a daycare. We prepare some of the most vulnerable children in our communities to not only succeed in school, but to teach them skills. We teach them skills that go beyond the classroom. We are a federally funded program. All Head Starts are. However, we are allowed to individualize and follow the needs that our individual communities have. And so each of our Head Start centers looks a little bit different because of that, because we're reflective of the community that we're in. We deliver services to both children and families. So our goal with children is for them to be physically, emotionally, and cognitively ready for school. And the large focus that we have on parental involvement, their goal is to ensure that they are getting, a part of their child's education, making sure that they're taking them to the dentist, or if there are some external needs that they have, we have a lot of partnerships with mental health centers and doing a lot of referring with that. Really trying to make sure that the family as a whole is taken care of through this program. Our funded enrollment with Head Start is 135 children, and to date this year, we've assisted right around 180 students. We provide 2 healthy meals and a snack per day through our partnership with the Child and Adult Care Food Program. I have to remember that one through the acronym. And we've served to date right around 37,000 nutritious meals. So it's a lot, right? Of the 158 families that we've assisted, we have 64 that are 2-parent families, 94 that are single parents, 111 that have at least one parent or guardian that is employed, 9 are in foster care, 6 are considered homeless, 40 live below the 100% of the federal poverty guidelines, and 17 are over 110% of that. And 61 children are in families that either receive SNAP or SSI. Now, as it relates to how Head Start or early childhood, daycare, childcare helps with the workforce. So reliable childcare and educational services allow parents to enter or remain in or return to the workforce. And without it, many parents would be forced to reduce their hours, switch to lower paying, more flexible jobs, or leave the workforce entirely. And it also greatly contributes to long-term economic mobility. So parents can pursue career advancement, or further their education. And we've seen that investment in early childhood education yields high returns through better educational outcomes, reduced crime rates, and increased productivity. But also it has a direct effect with, students don't need remedial education later on in life. There's a decrease in the need of social services later in life. So it is really, a critical part of this. And I want to close this by saying all of our communities have multifaceted problems that require multifaceted solutions. So just because we're offering Head Start doesn't mean that it only affects early childhood education. It also affects what Beth's doing and Shalise is doing, because it is all of our problems that we're facing are multifaceted. So.
That's a great call out, Brad. And I just want to reinforce something that you said there. Head Start doesn't only serve children. That's a huge component of it, but it is a family-oriented program. And every family enrolled in Head Start sets a family goal. And that might be higher education, or it might be a new job for a parent or guardian, something along those lines. So it really is about serving the complex needs of an entire family through the channel of early childhood education. And it does tie into so many of the other things we're working in our community. Beth, similarly, when we talk about healthcare, we talk about physical and behavioral mental health. It's something that has a tremendous impact on our communities as well as an individual's overall well-being. It plays a role in the stability of our workforce. How do you, as a healthcare organization, tackle such complex needs?
Well, I mean, I think it starts, right? It starts with the patient in front of you, and just making sure that you are just having a discussion with the patient about what's their goal. What do they want? What Beth Keeney thinks the patient needs may not at all be what that patient wants. And so just having a discussion with them about what are your goals? What is it that you want to see for yourself and for your family and for your community? I think that healthcare, like education, I love Head Start because it is a family program, and it does give I think an opportunity that healthcare gives, and I think they are like one of those rare opportunities that society gives a community to make a huge difference, and not just in one area. Like if you can help a family figure out their education situation, or provide education and daycare stability. If you can help a family access medication that helps them be stable enough to go to work, and helps them be healthy enough to go to work. If you can help a patient have their behavioral health or substance use disorder stabilized, or even go into recovery, and that individual can go to work and be self-sustaining, law-abiding parents and neighbors. I mean, my goodness, that changes a community. It just changes everything. And you don't get that opportunity in society often. And I think education and healthcare are some of those real rare opportunities you get to do that. But none of that happens in isolation. And I love what Brad said a minute ago about multifaceted solutions, because these are complicated problems, and they are complicated over generations. And they didn't just happen because we have a new administration that wants to try things a different way. I mean, these things happened over the course of decades. And so I think, to answer your question, like there's no real simple solution or simple answer to that. From our perspective, it certainly starts with the patient in front of you, but pulling out a little bit and looking at it more broadly, I think at the root of public health and community health, that really lies in the community. And I'm a big believer that the community should decide what their healthcare landscape looks like. And so if you have been, and the executive director of the Primary Care Association in Indiana says all the time, if you've been to one community health center, you've been to one community health center. And my guess is that's true for Head Start and for community action agencies as well. If you come to one LifeSpring office, you've been to one LifeSpring office. The office where I work in downtown Jeffersonville is totally different, has a totally different vibe than the office on Sharon Drive, 2 miles away. The population is different. The staff has a totally different culture. How people interact with patients is different. It's very different. So when you go from county to county, again, totally different, different populations, different social norms. And that's exactly how it should be. When you're in Washington County, it should be different than when you're in Jeffersonville, in downtown Jeffersonville. And so I think my very long-winded answer is you treat the person in front of you. You work very closely with your colleagues, with your multidisciplinary colleagues working on the same treatment team. Again, everybody working to treat the person in front of you, but more broadly, you're embedded in that community, not as an isolated treatment service provider, but as a part of the community, trying to work with all of the other service providers to really meet the needs of the community and make sure that everybody has access to health care and that those babies going to Head Start have the physicals that they need and the vaccinations that they need, because that's what our role is. And that Brad's team, they're doing the education and they're working with mom and dad on making sure that their goals are met. And they're working with Shalise so that they can make sure that they've got their vocational opportunities. So it really is just understanding what your role is and figuring out how we're all going to work together so that we're all, working together and moving the needle.
Excellent. And something I heard you say there is just this focus on community and to working together. And I know this group works a lot with community members, with clients, with lawmakers, with partners. And a big part of that is education around what we do. Are there any misconceptions you find yourself needing to dispel around your work or organization or the people that you serve?
I'll jump in. I mean, I think I hear often that you have to be uninsured to come to LifeSpring. That's certainly not true. That as a safety net provider, you have to be underserved, and that's not true. We are awesome for access. If you want to be a new patient, we can get you in pretty quickly, and that's not true for a lot of like the hospital type groups. Also, I think that people perceive that you have to have a very serious mental illness to come to LifeSpring. And so they will hesitate or hold out, and that's not true. We eagerly and enthusiastically encourage people to access care. Like if you think, do I need a therapist? You've already answered your question as far as I'm concerned. Like, give us a call. Worst case scenario, you come in, you have an intake and you go, I've talked it all out. I feel better. It's like, great. We're glad you need help. And we're happy to help do that. We also can help with more than behavioral health or vaccinations or well woman checks. We can help with transportation and food and all kinds of things. So again, I would just encourage folks that if you've got some health related needs, give us a call. And also, importantly, and again, I just really want to underscore that there are crisis services available in the community. If you give us a call, it does not mean that you're going to the hospital. It does not mean that you're going to jail, but you can call us. If you or a loved one is in a behavioral health crisis, 833-SAFE-988, 833-SAFE-988. And we can just kind of help you figure out what your next step is. So I think those are probably our most common misconceptions.
Brad, would you like to go?
Yeah. I'm impressed that you remember all those phone numbers, by the way.
I wrote them down, so I couldn't get them wrong.
I think a big misconception for the work that we do is the idea that the assistance we provide to people, it's going to people who either are unwilling to help themselves, or oftentimes it's just people taking advantage of the system. And I will say that the waste, fraud, and abuse that we see is tiny compared to the overall need in our communities. And oftentimes it's stopped at the local level before anything gets approved because we're in these communities, right? The people that we assist were neighbors, friends, possibly family members. Our kids go to school with their kids. We go to the same grocery store. we are accountable and transparent with our communities. So oftentimes, if someone is applying for assistance and they shouldn't be, we call them out on it before it even gets up to the level where they're going to receive some kind of supplemental assistance. And ultimately, our work makes the government work better. And I would say that about all three of us. We ensure that the government works better, more effectively, more efficiently, because we are in the communities that we are providing assistance in. And I said this earlier, we verify the need and efficiently respond to assist families who have fallen on hard times come out secure on the other end. And again, that the waste, fraud, and abuse that we do see is usually stopped before it even has assistance, that supplemental assistance tied to it.
Yeah. Shalice, do you have some misconceptions you're working to overcome?
So I say the biggest one that I think, we are not the unemployment office. So the unemployment office was taken out of the regions a long time ago. We are actually, I like to say, the reemployment office. Our coaches are here to help not just find a job, but to help you find a career. They have, to make sure that they help overcome any barriers that you have so you can, be a productive, citizen, so you can, you know, help you reach self-sufficiency. They stay in your life and they check up on you. Like they're there for over a year. They check in. We have other services. We work with businesses. We have different grants. We have youth services. We have apprenticeships. I mean, there's a number of, different things that we do. Um, you can, get on the phone and you can dial to get to unemployment, but we are not the unemployment office. But we will help you, when it comes to reaching employment.
Yeah, I heard you kind of all say it, but I think the most common misconception we overcome here at Cassie is that the work that we offer is single service. So, as an example, how does providing someone with a food box move them out of poverty, which is our ultimate goal? When we know that providing food to families frees up financial resources for other needs like housing and transportation, it improves health and it creates a stronger sense of community. How do you feel that your work really moves the needle on the issues that you're trying to address as far as going beyond that single touch point? Shalice, would you like to go?
I would say our goal is to lead a robust talent development system and cultivate a skilled workforce that advances our community, economy, and a quality of life. We believe in empowering individuals. We are dedicated to build programs, workshops, we have job fairs, etc., that meets the needs of our community. I feel that our work with our youth, does this and more. They are our future. They're our workforce. We must prepare them for what's coming. Our neighborhood location that said, community action of Southern Indiana, being able to be there, be where the people are. We want our coaches to be in the community. If you don't have transportation and, that's your barrier, we want to, help you figure that out and go, where you are. If we need to meet you at McDonald's or, wherever, just so we can help you. We just want to be able to do whatever it takes.
Thank you, Shalice. Brad, do you have thoughts on this?
I do. We empower hardworking Hoosiers to take charge of their lives. And here at OVO and across almost every community action agency in the U.S., we view our people that come through our doors as naturally creative, resourceful, and whole. And they don't need someone from Washington or Indianapolis or Madison, where I'm based at right now, to tell them how they should change their lives or how they should raise their kids. And we believe that we're partners with them in this work, that oftentimes what we provide is a one-time supplement, or maybe it's some guidance to overcome whatever challenge they're facing. And at the end of the day, we know that if we can't help them with whatever issue they're having, we have great partners that can. And so we know that at the end of the day, they're going to receive the help that they need to overcome whatever challenge they have.
Thank you, Brad. Beth, thoughts?
I just kind of echoing what Brad and Shalise said. I mean, I think as the safety net provider, the most important thing that we can do for our communities is to show up every day and to say, we are here. I can't promise you that we are going to be able to fix everything. We're not going to be able to fix all of the problems that you have, because we do have our patients come in very complicated. They come in with a lot going on, but they are incredibly resilient. And so if they will work with us and they will commit to kind of working through some of the challenges that they have, we will work hard with them, and we will really walk with them hand in hand and kind of try to work through some of those things. We're very fortunate to be a part of lots of different types of programs that traditional healthcare settings may not be able to take advantage of, including pharmaceutical programs. And so that allows us to get access on their behalf to medications that they wouldn't be able to have access to otherwise. For example, if they're cost prohibitive, transportation programs, those sort of things, which can really help them in terms of improving their health and overall quality of life. And so I think it's just really it's very important as a safety net provider to let our patients know that, you may be marginalized other places. You may not be treated well other places, but when you come to us, we're going to treat you well, and we're going to treat you exactly how we would want to be treated and how we would want our family members to be treated. And in fact, many of our family members do come and access services at LifeSpring. So we just try to make sure that we take really good care of people, and that will pay benefits down the road for those patients and for our communities.
Thank you so much. We're coming up on our questions here, but I have one in the chat if anyone feels comfortable answering. Charles asked, I've seen a growing demand for healthcare workers in the region. From your position, do you believe the demand of the region is being met? Shalise or Beth, you might be best equipped to answer that one.
First, I will say for any healthcare workers who are listening, I'm always hiring. My inbox is open. Feel free to DM. I think COVID laid bare so many problems and complications that existed in the healthcare system and really exacerbated so much of what healthcare workers were already feeling. And we have seen a lot of people leave the traditional medical environment, traditional healthcare environment for work at home type jobs, as well as just exiting healthcare entirely. And we're starting to see those kind of pipelines pay out now. We're seeing more folks leaving college. I know the school systems are doing a lot in early childhood as well as high school age in terms of trying to create interest and maintain interest in the healthcare workforce. There is still a high demand for nurses and social workers and really anyone who wants to work in direct patient care. So I don't think that the demand of the region is being met. I think Shalise probably has some great data on this. I do think that the demand will continue to be there. I don't think on the supply side we are there yet. I think the demand will always be there, especially as we start to see the continuing aging of the boomers. But I think we are a little better off, and this is my gut feeling. I think we're a little better off than probably where we were 2 years ago, but we still have a long way to go before the supply meets the demand of licensed healthcare workers.
I would agree. We definitely are still in the demand of healthcare workers. I usually have that's one of the things I was going to say. Talent Tuesday every third month, and I usually always have Norton's or Baptist here hiring, looking for healthcare workers from janitorial, all the way up to nurses and registration. I mean, there's a list. So it's definitely, they're looking. So we also, our apprenticeship, our youth apprenticeship, we have um, a great youth apprenticeship program where it's, healthcare based. And they are actually just picked their field, going into a healthcare field. So it's definitely in demand. So if you're looking, actually the 20th, Norton's will be here, 2125 State Street, at 11 a.m. We're having our Talent Tuesday job fair. So I'm sure there'll be plenty open jobs.
And you have engaged some really creative technology, including the VR goggles to let folks figure out what the right path is for them. So kudos to you and your team for trying all of the things to get people where they can be the most effective and find what they need.
Thank you. We also, there's also, other positions. We've also, talked about the sterilizing tech positions. There's, a lot of different things out there. So if you, think that you want to do that or don't know, you can always go on my website, sewingworks.com, and there is a assessment on there. If you want to take, the 30-minute assessment, or I think there's a 60-minute assessment to see if that's the field that you want to go into. Just quick little question and answer, but feel free to reach out. All of our services are free. So just look us up.
Brad, is there anything you wanted to add to this topic?
I do. I'm going to put on my workforce development hat that I did before this job. I think in rural communities, there's a misconception that in order to increase the amount of healthcare workers, you have to do a lot of talent attraction. And I think that that's part of it. But again, multifaceted problems require multifaceted solutions. I really like the idea of what would it take to upskill case managers or recovery coaches, and what kind of pathway would that look like for them to become licensed therapists, right? I know here in this area, we're a mental health desert, and the need definitely outpaces the amount of workers. And so, if we have, we need, I don't know, let's say seven therapists in this area to make up for that need, what would it take to upskill some of those frontline workers to fill those positions? And I think really trying to be creative, like what Shalise was talking about, goes a long way with that. So, yeah.
Excellent. Thank you for your thoughts on that. I know we're coming close to our time, and I want to give each of you the opportunity to share something going on in your organization that you're excited about or that you wish people knew, a recent story of success to help close us out. So, Beth, would you mind going?
I've already talked about crisis services, and again, 833 SAFE 988. And I talk about that so much just because it is just absolutely a game changer. And in my nearly 20 years working in community health, I've never seen a service that has made such an impact on the community. And that really just provides such an opportunity to get people into the right level of care. And so I, again, 833 SAFE 988. But just a quick story. Recently, once a year, we have a retreat for our management staff as well as our board of directors. And we were out in what we call our Western Division. So we were out in Orange County. And there were a few of us having dinner with some of our speakers. And we were at the we were out at West Baden and having dinner in the atrium. And there was a person on staff there who said, are you all here like on vacation or something? And I said, no, we're here for work. We have a meeting tomorrow. And they said, where do you work? And I said, I work at LifeSpring. And this was a younger person, probably early to mid 20s. And they just kind of stopped and they said, LifeSpring saved my life. And then they shared the story about how they accessed care at a very difficult and challenging time in their life. And they just said, wow, this is just so incredible to meet you all. Thank you so much for the work that you do. I'm doing great. I don't need services anymore, but I know that I can come back if I need to. And I'm so fortunate to be able to serve at LifeSpring. And I would say virtually every single person that works at LifeSpring has a similar story where they're stopped in the community and somebody says, I got services at LifeSpring, or my sister got services at LifeSpring, and it really helped me. And thank you so much. And so there are a lot of very interesting and very difficult days in healthcare and in community health, and those sort of days just really kind of build you back up and fill your cup. So that's me ending with a feel good story. And Adrienne, thank you so much for bringing Brad and Shalise and I together to talk with you about just the importance of maintaining just stability in federal funding and in policy, not just funding, but just maintaining stability in policy and funding, because these dollars do matter and they matter here locally. And these are decisions that are consequential, that impact people's lives, not just whether or not they have the lights that turn on in their house, but whether or not they are alive, literally. And so I'm very grateful for the opportunity to be with you all tonight and talk about the impact of federal dollars.
Thank you, Beth. Shalise, would you like to go?
Sure. I guess I have a story, I guess, of a gentleman that actually approached me at church and told me he kind of needed help finding a job. He actually had two jobs, but he wanted to do something that, you know, paid a little bit better. He told me that his problem was that he had just recently um, got out of correctional facility. He had a 14-year stay. And I told him he should, just come by and see me. And I'll hook him up with one of our coaches. And I like to brag on, one of my coaches because she does a really good job with our individuals. And so she worked with this young man and, got him working. And he actually started in February. He graduated with his CDL in March. And, he is so thankful because he, was able to leave his two jobs because now he has the one job and it pays very well. And, he told me that he didn't ever think that he would ever be able to, find a job like this that would pay this much. So things like that just, it makes you feel really, really good. Um, so that is just a feel good story. Um, and I still want to, let everyone know about our Talent Tuesdays that we have every third Tuesday of the month here at the State Street location at 11 a.m. And we also have our location at Community Action, and we're there every Tuesday and Thursday. So stop by and see us.
Come by and see us. Brad, no pressure, but I'm giving you the honor of a last story or celebration to close us out.
Well, how can I follow those two?
It's really
So I'm going to take this in a little bit of a different direction. Our Head Start program is celebrating its 60th birthday, which is a huge testament to all of the staff and the community leaders and students and parents that we've had for 60 years, that we've made it this far. And we have celebrations planned across all of our locations this week and other events throughout the month to kind of share the success of 60 years with students and families and community leaders, because 60 is a really big deal. Trying to think of other nonprofits or community programs that have been around that long is a testament to the work that we do every day. So that's kind of the success that I have. I just finished our client satisfaction survey, so I can talk to you about we've had parents say that they've seen a remarkable turnaround in their kids' behavior. Or I had a dad who said, look, I didn't know how to get involved with my kids' education, and you all have given me an opportunity to do so. Thank you. That's why we do what we do. And I am excited about having birthday cake so many times this week, and really showcasing to our partners, both, or I guess, students and families and community leaders, that we share in this success together. So thank you. And thanks for having us. I really appreciate this. This has been great.
a great conversation. And that was a tough slot to go last with a good story, but 60 years is nothing to sneeze at. That's incredible. We'll be celebrating here at Cassie too. So birthday parties all around, lots of cake. I just want to say thank you so much. The folks represented here do so much work within Southern Indiana, and yet represent only a sliver of the work being done. So take what you heard today and amplify it by 100, and you'll have a better idea of everything that's impacted by federal funding just here in our local community. So Beth, Brad, Shalise, thank you so much for giving your time here at the end of the day and sharing your insights. Everyone, thank you for joining the call. And this is being recorded, so we'll get it shared out for anyone who cares to follow up. Thank you.